The topic I decided to focus on was drugs and alcohol abuse. My social organization is the Los Angeles Center for Alcohol and Drug Abuse, also known as LA CADA. Drugs in America are definitely an epidemic. 24.6 million Americans use illicit drugs. 6.5 million use psychotherapeutics. 19.8 million use marijuana. 1.5 million use cocaine. And 1.3 million use hallucinogens. The War on Drugs was created in 1971 by Richard Nixon. The federal law adopted aggressive policies to curb drug abuse. Since the 19 early 80s, the United States have been implementing these aggressive criminal statutes in hopes of reducing and punishing drug abuse. Federal offenders are now required to serve 87% of their sentences. Drug laws are not equally enforced in America. Although Caucasians use drugs more frequently, African Americans account for 80 to 90% of offenders sent to jail on drug charges. The war on drugs did nothing but increase the prison population by 21 times than what it was before. More than 14 million workers qualify for substance dependency, increasing occupational risk factors of drug abuse in the workplace. Alcohol is the most abused drug in the United States. Underage binge drinking is common among high school and college students, but mostly they will outgrow this at a later age. Tobacco is the world's number one problem drug, killing more individuals than all other illicit drugs combined. Marijuana, also known as the gateway drug, is most commonly used by adults and adolescents. Recently, club drugs such as MDMA, GHB, and methamphetamines have become more common to enhance the club experience. Social action. Federally funded programs such as the National Institute on Drug Abuse, the Office of National Drug Policy, the National Institute on Alcohol Abuse and Alcoholism are all used as drug and alcohol abuse prevention and rehabilitation methods. The decriminalization and legalization of certain illicit drugs will play a vital role in reducing our prison population. Current legislation has done nothing but eradicate the problem. Drug treatment programs such as counseling, behavioral treatment, and psychotherapy are used to reduce drug use. In 1997, the Drug Free Communities Act was designed to reduce substance abuse amongst our youth across America. History of the Los Angeles Centers for Alcohol and Drug Abuse. La Cata was founded by Dr. Ethan Allen in 1971. The original name was the Rio Hondo Area Drug Abuse Coalition. In 1986, the agency decided to broaden its mission to include the prevention of drug abuse and HIV and AIDS. In 1988, Dr. Allen united the Open Door Clinic with the Rio Hondo Community Action Network to become LA CADA. The Los Angeles Centers for Alcohol and Drug Abuse has effectively made the conversion from a community coalition concerned with the wealth of its residents to the innovative social service agency it is today. Programs and services offered. Residential treatment, which is a premier residential program that has integrated and comprehensive treatment models concerning the disorders of their residents. Mental health services to provide mental health evaluations, therapy, medication management, and other mental services. Outpatient services are provided at 2 locations in downtown and Santa Fe Springs. Domestic violence, parenting, family therapy, drug counseling, and anger management, and HIV and AIDS are all classes that you're able to take. Counselors are also available to address the youth concerning any drugs or substance abuse needs they may have. Target population of La Cata is the city of Los Angeles and Hollywood, also focusing on the multicultural community of Santa Fe Springs. Addiction care is available for men and women ages 18 and over. Services to adolescents ages 12 to 17 in an outpatient setting are also available. The goals include to save lives, unite families, and protect the community through addiction counseling and healthy living education. Their vision is to enhance the educational and economic well-being of the people they serve by the means of direct human services, advocacy, and referrals. Some of their values include embracing the empowerment of people through compassion, perseverance, and respect. They are able to provide a wide range of services thanks to a collaborative approach compatible with the healthy communities that they desire to see. La Cata is a non-profit organization that receives federal and state grants, also receiving private funding and grants from companies such as Kaiser Permanente. Some of the obstacles or challenges they face are the disparities found in the reporting of symptoms, diagnoses, and treatment outcomes for African American patients. Helping individuals abstain from drug use by finding a stable living environment that supports their long-term recovery efforts. Effectively treating the homeless population without massive recidivism rates. La Cata is a progressive company that helps so many throughout the county of Los Angeles. The development of relapse prevention skills help fight the temptations of drug and alcohol abuse. Increasing national support of finding a good support system is also vital in overcoming drug and alcohol abuse. And the recovering housing has been effective in keeping many people who do not want to be homeless off the streets